Now, which epileptic syndrome is associated with left hemispheric atrophy in a child? A. Dravet syndrome. B. West syndrome. C. Lennox-Gastaut syndrome. D. Dyke-Davidson-Masson syndrome. A. Dravet syndrome. B. West syndrome. C. Lennox-Gastaut syndrome. D. Dyke-Davidson-Masson syndrome. What do you think is the correct answer here? Is it Dravet syndrome? Is it West syndrome? Is it Lennox-Gastaut syndrome? Is it Dyke-Davidson-Masson syndrome? Now let us look what the correct answer here is. The correct answer here is Dyke-Davidson-Masson syndrome. Now, Dravet syndrome, West syndrome, Lennox-Gastaut syndrome are all epileptic syndrome. And Dyke-Davidson-Masson syndrome has a characteristic childhood cerebral hemiatrophy features. In Dyke-Davidson-Masson syndrome, there is hemiatrophy or hypoplasia of unilateral cerebral hemisphere. This results from CNS insult in the fetal or early childhood period with compensatory ipsilateral calvarial hypertrophy. The insult could be vascular, congenital, acquired ischemic disease, or trauma or inflammation. In utero gestational vascular occlusion involving middle cerebral vascular territory or coarctation of mid aortic arch may decrease the carotid artery flow. So, Dyke Davidson syndrome, there is a left hemispheric atrophy. A 5-year-old boy has recurrent infections, low platelet count, and a rash, as you can see in the image. What is the likely diagnosis? A. Severe combined immunodeficiency. B. Jobs syndrome. C. Brutton's agammaglobulinemia. And D. Wiskott-Aldrich syndrome. There is a eczematous rash is there. Low platelet count, that is thrombocytopenia is there. Recurrent infections means immunodeficiency is there. So eczematous rash, thrombocytopenia, and immunodeficiency, that is recurrent infections, are the features of Wiskott-Aldrich syndrome, which is X-linked recessive disorder. So the correct option here is D, Wiskott-Aldrich syndrome. Now let us move to the next question. Which of the following scoring is done to assess respiratory distress in neonate? A. Crib score. Now what is Crib score? Crib score is clinical risk index for babies. It is a tool for assessing initial neonatal risk and comparing performance of neonatal intensive care units. Then what is SNAP score? SNAP score is score for neonatal acute physiology. It was developed by Richardson in 1993 for babies of all birth weights and validated as a predictor of mortality, morbidity. It is a physiology based score that uses 34 routinely available vital sign and laboratory test results. Now, Silverman Anderson score. Silverman Anderson score is used to quantify respiratory distress in preterm neonates. So, the correct option here is Silverman Anderson score. Now, which of the following genes is implicated in the pathogenesis of juvenile myoclonic epilepsy. A. FMR1. B. Fibrillin 1. C. CHYNN1. D. GABRA1. It is GABRA1. Juvenile myoclonic epilepsy has been linked to mutation in many genes, which include CACNB4, CLNC2, GABRA1, GABRD, myoclonin 1, and EFHC1. So the correct option here is GABRA1. True about fragile X syndrome is True about fragile X syndrome is A. Triple nucleotide CAG sequence mutation. 10% female carriers mentally retarded. Males have IQ of 20 to 40. D. Gain of function mutation. Let us look at the first option. Triple nucleotide CAG sequence. It is false because in this fragile X syndrome, CGG repeats are seen. Then second option, 10% female carriers mentally retarded. No, mental retardation occurs in 35% of female carriers. Third option, males have IQ 20 to 40. Yes, this is true. D, gain of mutation. No, there is no gain of mutation. There is silencing of FMR1 gene. So the correct option here is C. In which of the following diseases these X-ray findings are seen? A. Gaucher's disease. B. Fabry's disease. C. Markey disease. D. Niemann-Pick disease. Here you can see peg-shaped metacarpals and rounded vertebral body. Peg-shaped metacarpals are there, rounded vertebral bodies are there. Anterior beaking is seen. It is seen in Markey's disease. In which of the following disease the skin rash shown in the picture? A. Multiple carboxylase deficiency. B. Biotinidase deficiency. C. Alkaptonuria. D. Heart nerve disorder. Here you can see the characteristic skin lesion on neck. It is called as Casal's necklace. It is seen in pellagra, that is niacin deficiency, and heart nerve disorder. So the correct option here is D, heart nerve disorder. An 8-day-old neonate presents with hypoglycemia. The glucose is just 17 milligram percent, and jaundice is diagnosed to have a metabolic disorder. The likely diagnosis is A. Hypothyroidism. B. Galactosemia. C. Glycogen storage disease. D. Fatty acid oxidation. Here, hypoglycemia and jaundice in a neonate after the initiation of breastfeeding suggests a diagnosis of galactosemia. So, correct option here is B. Galactosemia. Identify the disease in a child with violet colored rashes around the eye and on hands. A. Juvenile dermatomyositis. B. Systemic lupus erythematosus. C. Kawasaki disease. D. Hinoch-Charlin purpura. The correct option here is C. Kawasaki disease. Identify the device used in resuscitation. A. Pulse oximeter. B. NIBP monitor. C. Defibrillator. ETCO2 monitor. It is a defibrillator. A 2-month-old baby with central cyanosis presents with following findings. The correct option here is Epstein anomaly. The skin lesions shown in the picture are seen in which heart disease? Eisenmenger syndrome, rheumatic heart disease, infective endocarditis. It is seen in rheumatic heart disease. The following X-ray picture is seen in which congenital heart disease? It is TAPVC. Which congenital heart disease associated child's condition? ASD, VSD, PFO, PDA. is AST. Luton-Bacher syndrome comprises of A. ventricular septal defect with aortic stenosis, B. ruptured sinus of Valsalva, C. atrial septal defect with mitral stenosis. The correct option here is atrial septal defect with mitral stenosis. Which of the following conditions can give the given figure be associated with A. parvovirus, B. infection, B. MDS, C. Down syndrome, D. Fanconi's anemia? It is Fanconi's anemia. The following X-ray finding in skull can be manifested. Here, hair on end appearance, it is seen in thalassemia. What do you see here? It is a polycystic kidney disease. Correct option here is polycystic kidney disease. Maximum urinary osmolality in a preterm neonate is 500. What is the most common complication of malaria in children? It is severe malaria anemia. Superior rib notching is seen in osteogenesis imperfecta, neurofibromatosis, Marfan syndrome, coarctation of aorta. Correct option here is D. Coarctation of aorta. Abnormality given in peripheral smear. Here you can see sickle cells. It is sickle cell anemia. Poor prognostic indicator of ALL is hypoploidy is a poor prognostic factor.